The Southern Africa Regional Collaborating Centre, Southern Africa RCC, was established in July 2017 as one of the 5 RCCs of the Africa Centres for Disease Control and Prevention, Africa CDC. Hosted in Lusaka, Zambia, the centre has provided much-needed connection and coordination between Africa CDC headquarters in Addis Ababa and the 10 African Union member states in the Southern Africa region: Angola, Botswana, Kingdom of Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia and Zimbabwe.
For us, this gives us an opportunity, one, to anchor the regional body, to strengthen in-country coordination, collaboration, communication, and also to ensure that we up our game in terms of investing in the various assets which we have as a country. This opportunity also has placed Zambia at the epitome of response with respect to various outbreaks, pandemics, and in general the public health threats and emergencies which may besiege us. What this does is that Zambia now will be a spotlight as we coordinate the other member states.
Since its inception, the RCC has facilitated an assessment and mapping of existing public health capacities in the Southern African region, leading to the identification of key public health priorities and the development of a strategic plan to address the capacity gaps.
Our mandate is to support all those countries build resilient healthcare systems that can respond, detect any health emergency in the countries where there is infectious outbreak.
I don't know whether it is me. There's nothing on the video. There's nothing on the screen. Are we having a technical glitch?
The Southern Africa Regional Collaborating Centre Southern Africa RCC was established in July 2017 as one of the 5 RCCs of the Africa Centres for Disease Control and Prevention Africa CDC. Hosted in Lusaka, Zambia, the centre has provided much-needed connection and coordination between Africa CDC headquarters in Addis Ababa and the 10 African Union member states in the Southern Africa region: Angola, Botswana, Kingdom of Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia and Zimbabwe.
For us, this gives us an opportunity, one, to anchor the regional body, to strengthen in-country coordination, collaboration, communication, and also to ensure that we up our game in terms of investing in the various assets which we have as a country. This opportunity also has placed Zambia at the epitome of response with respect to various outbreaks, pandemics, and in general the public health threats and emergencies which may besiege us. What this does is that Zambia now will be a spotlight as we coordinate the other member states.
Since its inception, the RCC has facilitated an assessment and mapping of existing public health capacities in the Southern African region, leading to the identification of key public health priorities and the development of a strategic plan to address the capacity gaps.
Our mandate is to support all those countries build resilient healthcare systems that can respond, detect any health emergency in the countries, whether it is infectious outbreaks or is a man-made or is a national disaster.
As a regional centre, the RCC has played a pivotal role in bringing member states in the region together regularly to exchange information, knowledge and experience in the response to several public health emergencies.
We have been able to fight a lot of the diseases as a bloc and support each other. At some point, our region had listeriosis. We teamed up the whole region to fight it. We had a number of cholera outbreaks. We were able to mobilize the teams within our region to go and support Malawi, to go and support Zimbabwe. We had the Ebola outbreak in Democratic Republic of Congo. Again, we were able to mobilize some of our teams to go and help. The other important thing we have established is what we call the ECO platform, which allows us to share a lot of information, a lot of public health events in our region. We connect all the member states and we are able to rally around and show solidarity when one country is hit with a particular outbreak.
The weekly ECHO calls provided a forum for member states to exchange ideas and work together in developing epidemic preparedness plans for Ebola and COVID-19 and to identify key steps in enhancing their technical capacity in country. In collaboration with its network of partners, the Southern Africa RCC continues to facilitate training activities for different cadres of healthcare workers, and this is helping to close the capacity gap in the region.
Our second objective is to have an opportunity to bring all the member states in these regions and also bringing along all the international health partners, the local health partners, together to promote collaboration, partnership, coordination in the region in context of the COVID-19 and beyond.
We have gone into a very big project under the World Bank, which is going to see the construction of the offices for our Regional Collaborating Center, construction of biosafety level 3 laboratory, which is going to save our region, construction of our public health emergency center, which is going to link all the member states. You can see that the doing of business, the order of public health now will be totally different in our region.
The hosting agreement between the African Union and the government of the Republic of Zambia was signed on the 8th of February 2019, and today, the 31st of March 2021, we are witnessing the official launch of the RCC.
The government of the Republic of Zambia remains indebted to the African Union and the Africa CDC. We'll do our best to ensure that the Southern Africa Regional Collaborating Center is the best on this continent. And what will measure that is to what extent the people in the southern part of Africa will be protected from various public health threats and emergencies.
Let us all have joy, rock, and strong and free. One and one unity and peace is our like an open praise to thee, all strong and free. Praise be to God. Bless our great God. Remember
Thank you very much. We may take our seats. Allow me at this juncture to recognize the presence of our honor, the Vice President of the Republic of Zambia, Mrs. Inonge Mutukwa Wina, MP. I recognize the presence of the Honorable Minister of Health, Dr. Jonas Chanda, MP, and all the cabinet ministers of health who have connected from the other 9 member states. Let me also recognize the presence of Her Excellency Mrs. Josepha Lionel Correa Sako, who is the Commissioner for Rural Economy and Agriculture, African Union Commission, who will be representing the African Union Commission today. I also recognize the UN family, all the agencies who are part of this launch. Let me recognize the cooperating partners, the senior government officials who are with us, and indeed the representatives of the non-government organizations. The Africa CDC Director, I recognize you. Members of the press, may I simply say, distinguished invited guests, ladies and gentlemen. I am Kennedy Marama, Permanent Secretary in the Ministry of Health, who is going to chair the opening session this morning. Let me mention that as a country, we are delighted to host the Southern Africa Regional Collaborating Center for the Africa CDC. I would like to welcome all of you to the launch under the theme, ensuring effective preparedness and response to current public health threats in the context of COVID-19 and beyond. Let me pay a special welcome to our honor, the Vice President of the Republic of Zambia, Mrs. Inonge Mutukwa Wina, MP. Ma'am, we are delighted that you found time to be here this morning. To all of you who have connected, Zambia would have loved to host you physically, but due to the COVID-19 pandemic, we had to ensure the highest level of physical distancing possible. Your virtual presence this morning is a demonstration of your commitment to enhancing public health security in our region, various emerging and re-emerging public health threats and emergencies. As you are aware, the African continent has 5 regional collaborating centers. These were established as support offices for the Africa CDC. And these regions hosting the RCCs include Central Africa, it's based in Libreville, Gabon. For East Africa, the RCC is Nairobi, Kenya. Northern Africa, it's based in Cairo, Egypt. Western Africa in Abuja, Nigeria. And Southern Africa here in Lusaka, Zambia as the host. It's also important to mention that for the Southern Africa Regional Collaborating Center, the 10 member states include Angola, Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, the host Zambia, and Zimbabwe. And allow me to pay special recognition to the other 9 member states, and also for finding time to be part of this launch. The Regional Collaborating Center is mandated to support the execution of Africa CDC's strategic plan in the regions and to support member states based on need. And this is what the Southern Africa Regional Collaborating Center hosted by Zambia, will be doing. With that, it's my singular honor to once again welcome you virtually to Zambia and wishing you a virtual successful stay. With that, allow me now to call upon our Southern Africa Regional Collaborating Center Coordinator, Dr. Rocc, to give his remarks and tell us the purpose of the launch. Dr. Rocc.
Thank you so much, Dr. Kennedy Malema, the Permanent Secretary for the Minister of Health, Republic of Zambia. Thank you so much for a beautiful introduction. But first, allow me to seize this opportunity to recognize the chief guest of honor, Her Excellency, the Vice President of the Republic of Zambia. Equally, also allow me to recognize the presence of the Commissioner of Rural and Economy and Agriculture for African Union Commissions in her capacity representing the chairperson of the African Union. Again, allow me to also recognize the Minister of Health of the Republic of Zambia and all honorable ministers of health in the Southern Africa region. Equally, allow me to recognize all heads of the UN agencies present and those who are not connected through social media. Again, I would like to see the opportunity to recognize the presence of Country Director of US CDC to the Republic of Zambia, Director of the African CDC, all colleagues from the African CDC and from the regional collaborating centers, Southern Africa in particular, distinguished delegate from all member states in the Southern African regions, ladies and gentlemen, on behalf of the Southern Regional Collaborating Centers, and indeed on my own behalf as a regional coordinator, I am very, very delighted and honored to welcome each and every one of you to this special moment of official launch of Southern Africa region. May you also allow me to say a word of gratitude and express my sincere joy and happiness to the technical committee that's organized such a beautiful function, led by none other than the Permanent Secretary of the Minister of Health of Republic of Zambia, co-chaired by Professor Victor McConaughey, the Director General of National Public Health Institute. On behalf of Minister of Health, Dr. Jonas Shanda, MP, and the Minister of Health, we are so proud with your commitment and your passions and dedication in supporting all the Southern Africa regional collaborating activities and perhaps all the African CDC initiative. I must acknowledge with sincerity that Southern Africa Regional Collaborating Center is one of 5 regional collaborating centers of the African CDC. And we are also proud that's to be the first to be in operation and also to be the first to be launched in official way. I want to congratulate all the dedicated staff of the Regional Collaborating Center, and all of these were made possible because of dedication and extraordinary support of the people and the government of Zambia. On behalf of the 9 other states, that's Dr. Malema mentioned. And today, ladies and gentlemen, we are here for 3 reasons, 3-fold objective. First is to operationalize the activity and the office of the Regional Collaborating Center. But also we are celebrating the beautiful milestones, the activities that has been in operation since 2017. So for us, it's a moment of celebrations. It's a moment of joy, of recognition, of commitment of the African Union through the African CDC, through the regional collaborating centers. Colleagues, the regional collaborating centers were created for one and only purpose: to turn the Africa CDC visions and the missions to provide the services to the member states in line with the African Union's and Africa CDC mission to support countries to build resilient healthcare systems that will respond and detect all the health emergency on time with able capacity and save life. The second objective, we are here to bring all the health partners, all the member states, all the regional economic communities in these regions to have an opportunity for a policy dialogue, for having a sincere discussions on what are the really health issues in these regions, and come and agreed on the best step forward on how to overcome those challenges. In addition, also we are here to promote an opportunity for better coordination, and partnership. Because we all know together we can be able to do big things. We can be able to produce the biggest impact in improving the quality, the health, the safety of the people in these regions. And we are looking forward for very sincere discussions addressing some of the key issues that has been around for many years in context of the COVID-19 and beyond. Our themes for this meeting, for this launch, is ensuring effective preparedness and response to all the health issues in context of COVID-19 and beyond. So with this, I want to thank you. I want to welcome you once again. And I want to wish all of us an opportunity to have a fruitful discussions. And congratulations to Southern Africa Regional Collaborating Center. Thank you.
Thank you very much, Dr. Liu, for setting the stage and telling us what the objectives of the launch are. At this juncture, we'll now go into our next component of the session. I will call upon the Africa CDC Director, Dr. John Kengasong, to give us a presentation on Africa CDC strategic vision, including the Regional Collaborating Centers framework for operation. You also outline the key mandates, the roles, and the responsibilities. Dr. Kengasong has been there, massive experience in public health and ensuring that the African continent creates resilience because the public health threats and emergencies continue hovering around us. Dr. John has made the continent's response to COVID-19 take a positive trajectory. So allow me invite Dr. John Kengasong to make this presentation. Dr. John, you have the floor.
Thank you, Excellency. Greetings from Addis Ababa and greetings from the Africa CDC. I would have personally loved to be in Zambia this morning, which I consider as my second home, thanks to the strong friendships that exist personally between me and the leadership there of the Ministry of Health, including my very good friend, Dr. Victor Mukonka. Honorable Mrs. Inonge, Mutukwa, Wina, MP, Vice President of the Republic of Zambia, Your Excellency, Mrs. Josepha Sako, the Commissioner of Rural Agriculture, Rural Economy and Agriculture of the African Union, Honorable Dr. Jonah Chanda, MP, Minister of Health of the Republic of Zambia, Honorable Ministers present here from the Southern Africa region, senior government officials present, representatives of member states present, the diplomatic corps, distinguished invitees, ladies and gentlemen. The Africa CDC was launched, as you recall, 4 years ago, so we just, in the last few months, celebrated our 4th anniversary. And the Africa CDC, I've always stated, symbolizes the vision and wisdom of our head of states, where in 2017, after the Ebola outbreak devastation in West Africa, decided to accelerate the launch of this important body for the continent, which represents our own aspiration to take the leadership and ownership of the health security of our continent into our hands. Our continental development agenda hinges on the ability for our people to be healthy. Health is wealth. We have faced three challenges. First of all, emerging and re-emerging diseases that is now common to all of us, including the current pandemic, the rising trends of non-communicable diseases, and the existing endemic challenges that we face on routine basis, i.e. tuberculosis, malaria, and HIV. We face a historic pandemic, ladies and gentlemen, which is unprecedented but predictable. The Ebola outbreak 5 years ago was a signal that something big was about to happen. The COVID-19 have shown us how we shared a common connectivity, how we shared common vulnerabilities, and how we share common inequities. And failure to prepare the continent against these threats will be preparing ourselves to fail. Ladies and gentlemen, on March the 3rd this year, the chairperson of the African Union Commission, His Excellency Mutukwa, at the African Forum, made an important declaration where he called for a new public health order for the continent, a new public health order that will allow us to build our health systems better, bolder, and bigger, and hinges on 4 pillars One is to increase and strengthen our workforce, public health workforce. Second is to focus on continental manufacturing of diagnostics, vaccines, and therapeutics. The health security of a people hinges on vigilance. We cannot continue to, each time we are confronted with a threat, rely on external factors to come to our rescue in the areas of diagnostics, vaccines, and treatment. Third, engagement with the private sector. The chairperson recognizes that we will not win the battle against these endemic diseases, emerging threats, and rising non-communicable diseases without a strong engagement with the private sector. And lastly, domestic financing that will complement other sources of support from our trusted partners, what we are calling trusted partnerships. Ladies and gentlemen, allow me to share with you a few slides that will clarify and provide insights into some of the statements that I just made. As you know, the Africa CDC Regional Collaborating Center in Zambia is one of our leading centers. And the vision of the Africa CDC, as inscribed in the original documents of our creation, stated clearly that by the head of states that it was designed to ensure a safer, healthier, and integrated, prosperous Africa. And these are all statements and vision inscribed in Agenda 2063, which is the Africa we want, which is a blue map for the development of the continent. And the health aspiration number one is key to that strategy. That is Agenda 2063. The vision is further divided into several key components, which include the promotion of partnerships and collaboration amongst member states. That's why we have the regional collaborating centers, supporting regional and country level hazard mapping, facilitating access to information, harmonizing our disease control and prevention policies and systems, and supporting countries to build their capacity both for medium term and long term. The best time to prepare yourself or ourselves against a disease was yesterday. Let me now focus on the mandate of the RCC, which is twofold. Is to support the execution of the Africa CDC strategic plan in the region and to support member states based on the needs and the regional priorities. I will not comment any further on where the 5 regional centers are based because they have been touched on already. But let me focus on some of the regional centers offered as a shared opportunity. In each region of the continent, we have extensive capacity, what we call biosafety level 4 capacity to serve as reference labs, which can, if we harness it properly, enable us to respond to disease outbreaks and threats. Training institutions and centers of excellence exist within each of the 5 geographic areas. It is up to us to use these centers to build a resilient response strategy. And lastly, to harness on all those assets to build a network. What we have established called the Africa Regional Integrated Surveillance and Laboratory Network. Here are some timelines that I will not go into details, but I'll leave that up to all of us to browse through very quickly to see how we have established the Africa Regional Center in Lusaka. So a lot of work has gone into this to this day, leading up to this day. So it's not today, actually, that we are starting, but we started about 4 years ago. So the RCC fulfills key functions along 9 objectives. First, as I indicated, to contribute in continent-wide coordination of regional health issues, to harmonize our disease control and prevention policies within each region, strengthen or support countries to strengthen international health regulations, collaborate with key partners. I'm very delighted that some of our key partners are present today. Work on surveillance and disease intelligence components, support countries in the public health emergency and response, improve information flow and data sharing, what we call data spectrum, from data acquisition, warehousing, use, and sharing, laboratory systems, and of course, health system strengthening overall. So those are the 9 key objectives. To get there, we shall use a basic stepwise approach, and where we will look at data management and interpretation, response activities according to Africa's CDC's strategic pillars, and transfer of activities to national public health institutes. We believe that for Africa's CDC to be effective, we must strengthen our national public health institutes. So we are very pleased that Zambia is one of the 15 countries in Africa with a strong and functional national public health institute. And at this point, I really like to acknowledge the extraordinary leadership of Professor Victor Mukonka, who has been a champion and a respected continental leader in driving the agenda for implementing national public health institutes. This is the governance structure of what the RCCs will look like. We have the Governing Board of Africa CDC, which exists already. On the left-hand side are the advisory and technical committees. The Africa CDC Secretariat will continue to provide guidance. Then the regional collaborating centers do have their coordinators, and there's a steering committee of ministers of health and a technical advisory committee. So we offer you a very simple structure that we believe will guide the activities of the regional collaborating centers. The functions of the governing board include the following. The steering committee will continue to provide strategic guidance for the regional health priorities, link into the economic regions or activities in the economic regions, provide oversight on Africa CDC's regional plans and initiatives, monitor progress on regional implementation. The technical advisory committee will advise the regional centers on strategic priorities for the region, advise the RCC on science, programs, administrative issues, and support in the review of implementing progress made in each region, and continue to adapt that as the need arises. So the operational planning or priorities include, for the next 5 years, the following. 1, a strong desire to establish and strengthen our regional integrated surveillance laboratory network. We believe in the power of partnership. We believe in the power of harnessing assets that exist in each region. Then, of course, strengthening the regional collaborating center itself, working with member states on disease outbreaks, preparedness and planning, and expanding the African Health Voluntary Corps, which is a decision of the head of states issued since 2015. Thank you, Excellencies, colleagues, for your kind attention.
And that presentation Kengasong has presented will be discussed. So in case you have clarifications, questions to make, that there will be provision for that. At this point, allow me then to, in the initial program, we are supposed to have 2 other speakers. Guidance has been given from the Africa Union Commission that we are going to have remarks given by Her Excellency Mrs. Josepha Correa Sacco, who is the Commissioner for Rural Economy and Agriculture under the African Union Commission. So allow me to call upon Her Excellency Mrs. Josepha Correa Sacco to deliver remarks. Your Excellency, you have the floor.
Thank you, Dr. Kenneth, for giving me the floor. I think it's a good afternoon, every one of you from Addis Ababa. I stand on behalf of the chairperson to deliver a statement. High Excellency, Honorable Vice President, Mrs. Inonge Wina, the Vice President of the MP and the Vice President of the Republic of the Zambia, Honorable Dr. John Shamba, MP, Minister of Health of the Republic of Zambia, Honorable Ministers of Health present here from the SADC region, Dr. John Kingunsa, Director of Africa CDC, senior government officials present, representative of member states present, distinguished guests, ladies and gentlemen, and all protocol duly observed. I bring you warm greeting from the African Union Commission in Addis Ababa, Ethiopia. The African Union Head of State and Governments, taking into account the health challenges prevailing on the African continent and the need for an accountable health security framework, approved the establishment of the African Center for Disease Control and Prevention, Africa CDC, at the African Union Summit in January 2015 in Addis Ababa, Ethiopia, as a specialized technical agency of the Union responsible for safeguarding the health security of the continent. The African Union Commission, in collaboration with other partners, works tirelessly to ensure the vision of our head of state and government becomes a reality by establishing the African CDC and regional collaborating centers, which is the RCC. And by January 2017, African CDC was officially launched in Addis Ababa, Ethiopia. It is a great honor that today we are witnessing the launch of the African Regional Collaborating Centers, RCC, for 4 years following the official launch of the African CDC. The official launch of Africa CDC happened at the beginning of my first term as the chairperson of the African Union Commission, and I am privileged and honored to be part of its growing and observe the tremendous progress made on its establishment and operationalization from its headquarters in Addis Ababa to its regional collaboration center, including the one that we will be launching today. The African Union Commission will like to take this opportunity to extend its gratitude to you, Honorable Vice President, and the government of the Republic of Zambia for agreeing to host and unveil your resources and efforts in ensuring the Southern Africa RCC is operational. Congratulations. I will also want to extend my sincere appreciation to the African Union member states in the Southern region, African region, the regional economic committees within the region led by the SADC, international partners, and other public health stakeholders within the region for the support that you continuously grant to us in ensuring the RCC becomes fully operational. Honorable Vice President, Excellencies, ladies and gentlemen, since its establishment, the RCC has supported several activities in the Southern African region. Many of these achievements have already been reported. These include the establishment of a functional office in Lusaka, hosted by the government of Zambia, and the support being provided to member states in their preparedness and response to a health outbreak, including COVID-19. This support includes the implementation of the African Joint Continental Strategy Coronavirus Outbreak, which was launched during the African Union Emergency Ministerial Meeting of the Ministers of Health that I convened in February 2020 at the beginning of the pandemic. The Southern RCC member states also continue to actively participate in several activities of the multidisciplinary and multi-sectoral African Task Force for Coronavirus Response. I urge all of you, honorable ministers, to encourage your senior staff to regularly attend this very important AIFTCOR meeting every Tuesday afternoon. In this regard, the African CDC, Southern RCC, has supported the deployment of over 5,000 communities, healthcare workers, and 42 rapid responders. They have also continued to support surveillance, contact tracing, clinical case management, expansion of the COVID-19 testing capacity through laboratory supply, and training of laboratory experts, and introduced and coordinated the ECHO platform, where important health information is shared across the region. The RCC has also supported epidemiologic modeling of the COVID-19 in order to guide intervention as well as infection prevention and control through training of healthcare workers and strengthening biosafety and biosecurity capacity in our region. I'm from SADC, sorry, in the region. We are proud of the tremendous progress made by CDC in supporting the regional, the regional and the all continents, but we still face several challenges that I would like to highlight here so that we can collectively address them to ensure that this Southern RCC is fully functional and deliver on its mandate. This includes insufficient resources for the implementation of health security agenda and public health priority within the region. 2, lack of timely data and information from member states to inform collective response efforts and regional strategy. 3, limited collaboration and coordination among different stakeholders within the region in utilizing available resources and effort to attain minimum public health outcomes. I hereby call upon all member states and all the stakeholders within the region during this story collaborate to make the Southern African region, Africa, they all stop this COVID-19 pandemic. Vice President, Excellencies, ladies and gentlemen, I would like to conclude by reminding all of us that health is both a security and an economic agenda. The continental, regional, and national development agendas will only be realized if we create safe environments that allow economy and livelihood to prevail without being hampered by public health events, as it has been demonstrated at the time of COVID-19 pandemic. Finally, let me express my sincere appreciation to you, Honorable Vice President, to Excellency Amira, our social region, for making
there.
Hello, sorry, I had a problem. Can you hear me, Dr. Kennedy? Hello? Hello?
We can hear you, Commissioner.
Yeah, I was finishing the statement of the chairperson. I had my network problem connection. Let me just finish.
Just go ahead. We can hear you. I think everybody's hearing you.
Thank you. Okay. Finally, let me express my sincere appreciation to you, Honorable Vice President, to Excellent Affairs and Social Development in African Union, Honorable, our collaborating partners, members of the press, and all participants for making your time in this historical occasion. I would like to assure you that the African Union Commission, through the African CDC Collaboration Center, will continue to support all the member states of the African Union and in ensuring that the continent is fully capacitated to prevent, protect against, and respond effectively to any public health threats. I thank you very much for your kind attention. I submit. Thank you.
And we remain indebted. Let me take this opportunity now to call upon our Honorable Minister of Health, Dr. Jonas Chanda, MP, to give the remarks, and thereafter call upon our Honor, the Vice President of the Republic of Zambia, to deliver the keynote speech. Honorable Minister, sir, I call upon you, your remarks.
Her Honor, the Vice President of the Republic of Zambia, Mrs. Inonge Mutukwa Wina, MP, Your Excellency, Musa Fak Mohammed, the Chairperson of the African Union Committee, Amira El Fadil, Commissioner for Health, Humanitarian Affairs and Social Development, the African Union Commission, Honorable Ministers of Health present, senior government officials present, the Director, Africa CDC, representatives of the member states present, the ladies and gentlemen, distinguished invited guests. Thank you to each and every one of you for being here with us today, albeit virtually. We are very pleased to welcome those of you that have been with us for a long time now, as well as those who are new to the community of the Africa CDC, Southern Africa Regional Collaborating Center, RCC. Today marks an important milestone in the Southern Africa region as we officially launch the RCC. Not only are we proud to be able to host this event today, but feel privileged to have been given the mandate of host country to the Southern Africa RCC. Since the establishment of the Southern Africa Regional Collaborating Center in July 2017, the Ministry of Health, through the Zambia National Public Health Institute, and mandated by the Zambian government, has supported the operationalization of the Regional Collaborating Center. Since inception, all the 10 member states in our region, namely Angola, Botswana, Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia, and Zimbabwe, have been engaged at various levels in the operationalization of the RCC, and I commend you all for the support. I am aware that during the various engagements, the converging point of agreement has been that together we must assure public health security in our individual states and in the region. We are reminded how vulnerable we are as a region, going by the so many public health threats and emergencies we continue to face, such as polio, measles, typhoid, cholera, Ebola, and now the COVID-19 pandemic that we're grappling with. All these public health threats have the potential to disrupt the health and socio-economic activities of our country and indeed of our countries and region, reminding us of the imperative of enhancing regional collaboration. Today's event emphasizes this mission and brings together health partners and economic communities in advancing health security agenda for our region. We look forward to the opportunities to strengthen the existing technical working groups and establish the remaining ones. We should leverage on the existing collaboration, coordination, and communication channels and existing regional structures to strengthen our network. Allow me now to call upon Her Honor, the Vice President of the Republic of Zambia, Mrs. Inonge Mutukwa Wina, to give her remarks and officially launch the Africa CDC Southern Africa Regional Collaborating Center. Your Honor, the Vice President of the Republic of Zambia. Thank you.
Her Excellency, Commissioner Josepha Maria Sanko, representing His Excellency Musa Faki Mahamed, chairperson of the African Union Commission. The Honorable Minister of Health for Zambia and the host, Honorable Dr. Jonas Chanda, MP, the Honorable Ministers of Health representing the member states constituting the Southern African Regional Collaboration Center, RCC, permanent secretaries and the other senior government officials in attendance, permanent secretaries and the Director, Africa Center for Disease Control, the Director and the representatives of the Southern Africa Regional Collaborating Centers, directors of National Public Health Institutes or equivalent, heads of surveillance and disease control units, representatives of regional economic committees in SADC and COMESA, distinguished ladies and gentlemen. Let me start by welcoming you and state that on behalf of His Excellency, Mr. Edgar Chagwa, President of the Republic of Zambia, and indeed on my own behalf, I am honored to address this important gathering on the occasion of the launch of the Africa CDC Southern Africa Regional Collaboration Center, RCC. Allow me to also congratulate His Excellency Musa Faki Mahamed for his re-election as the chairperson of the African Union. Further, let me extend congratulations to all the re-elected and newly appointed members of the African Union Commission. This is a mark of confidence of your hard work and that the results are well appreciated by the people of Africa. Congratulations once more. Excellencies, ladies and gentlemen, I wish to remind this gathering that we meet today as one continent, one people, with one goal of achieving an integrated, prosperous, and peaceful Africa driven by its own citizens and representing a dynamic force in the global arena. It is clear from this statement that as countries, regions, and the continent, we need to work together as member states and partners in development on the continent and the world at large. In this regard, Zambia is honored to host the 2 African Union organs in Lusaka, namely the Economic, Social, and Cultural Council, ECOSOC, which has been in Zambia since 2019. In addition, we are privileged to host the Southern African Regional Collaborating Center, which we are launching today. As a country, we take this honor with great respect and gratitude. Excellencies, honorable ministers, ladies and gentlemen, let me report that since the signing of the host agreement on 8 February 2019, Zambia has provided office space, staff, and other logistics, thereby operationalizing the regional center. I thank the Honorable Minister of Health in Zambia, Dr. Jonas Chanda, and his team for securing office space and the necessary logistics as part of fulfilling the provisions of the host agreement between the African Union and the Zambian government. As we mark this very important milestone, we are all aware that the negative impact of COVID-19 is written in bold all over the world. No one country or economy has been spared. And it is clear, or a clear reminder, that unless we collaborate to fight the pandemic, every country on its own will not win the war. Therefore, it is within such context that the Regional Collaborating Center will play its role of coordinating the region in terms of human resource, equipment, and the necessities to support the regional center to effectively execute its mandate with guidance from the Africa Center for Disease Control. We should therefore all gather courage not to further postpone collaboration and the implementation of what was planned, because the COVID-19 story is teaching us to do one thing: collaborate, or else remain alone as countries and yet face the consequences of isolation. With respect to isolation, the law of the jungle teaches us that any animal that isolates is likely to face the predators alone. This we want to avoid at all costs. Therefore, our coming together in this manner is clear recognition of the desire to move forward as one group, because some epidemics and pandemics know no boundaries. It is therefore in this interest, rather in the interest of all countries in Africa and across the globe, to collaborate and make concerted efforts to control the spread of COVID-19 while supporting each other to the best of our abilities. This call also goes beyond COVID-19 because the world is yet to experience more epidemics and pandemics in the future. Excellencies, honorable ministers, ladies and gentlemen, the impact of COVID-19 also reminds us of the need to rethink the way we collaborate in order to address public health threats that have the potential to disrupt the socio-economic status of our people in the region. While COVID-19 has ravaged the whole world and brought life to a near standstill, it has also exposed the brighter side of life, in that when nations work together, a lot more can be achieved for the benefit of everyone in the world. The gap and the manner in which the supply of COVID-19 vaccines is being administered globally is a classic example of international threats when countries work in isolation. Therefore, the launch of the Regional Collaborating Center on Public Health demonstrates our willingness to contribute to the African Union goal of uniting Africa for peace and prosperity across the continent. Excellencies, honorable ministers, ladies and gentlemen, as I conclude, let me state that while significant progress has been made in the past 3 years, there is need for member states to upscale and strengthen the Regional Collaboration Center by financing, equipping, and managing its programs well in order to meet regional expectations in line with the decision of the African Union heads of states and governments. I therefore call upon all member states to actively participate in the discussions, to set the regional targets and priorities in the context of COVID-19 and the other health issues in the region using established platforms. Finally, let me reiterate that Zambia remains grateful to the African Union, the Southern African member states, and cooperating partners for the tireless efforts of establishing the Regional Collaborating Center. This would not have come about without the support of the Africa Center for Disease Control, Africa CDC. Therefore, profound gratitude also goes to Dr. John Kengason, Director of Africa Center for Disease Control, for providing effective leadership along the way. I wish to convey my government's gratitude to the African Union Commission for providing support to member states in the region, Zambia in particular. I therefore request the ministers of health in the region to place a premium on the operations of the Regional Collaborating Center and its affiliate institutions in the respective countries. With your full support, the region looks forward to the full operationalization of the regional center. And on this note, it is now my singular honor and privilege to declare the Southern African Regional Collaborating Center officially launched in Zambia on this day, the 31st of March, 2021. May God bless you all. I thank you.
You turn on when you are clapping.
Mute. For that inspirational speech to the continent, the region, and indeed ourselves in Zambia. We've been reminded indeed that we can only create resilience, ensuring that nation collaboration and communication in the region, and also that Zambia remains true to the host agreement. Rocc of Zambia, Mrs. Inonge Mutukwa Wina, MP. With that, the next session is a group photo, and I'm sure people may be wondering, we've been guided
The Southern Africa Regional Collaborating Centre, Southern Africa RCC, was established in July 2017 as one of the 5 RCCs of the Africa Centres for Disease Control and Prevention, Africa CDC. Hosted in Lusaka, Zambia, the centre has provided much-needed connection and coordination between Africa CDC headquarters in Addis Ababa and the 10 African Union member states in the Southern Africa region: Angola, Botswana, Kingdom of Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia and Zimbabwe.
For us, this gives us an opportunity, one, to anchor the regional body, to strengthen in-country coordination, collaboration, communication, and also to ensure that we up our game in terms of investing in the various assets which we have as a country. This opportunity also has placed Zambia at the epitome of response with respect to various outbreaks, pandemics, and in general the public health threats and emergencies which may besiege us. What this does is that Zambia now will be a spotlight as we coordinate the other member states.
Since its inception, the RCC has facilitated an assessment and mapping of existing public health capacities in the Southern African region, leading to the identification of key public health priorities and the development of a strategic plan to address the capacity gaps.
Our mandate is to support all those countries build resilient.
So thank you very much. The group photo
has
been taken.
Detect.
And now the Vice President to take leave now. We are going to have a 10 minutes break, and then we continue after that with the strategic session. Once again, thank you very much for attending the official opening. And in 10 minutes time, we'll resume. Thank you.
Thank you.
The Southern Africa Regional Collaborating Centre (Southern Africa RCC) was established in July 2017 as one of the 5 RCCs of the Africa Centres for Disease Control and CDC. Hosted in Lusaka, Zambia, the centre has provided much-needed connection and coordination between Africa CDC headquarters in Addis Ababa and the 10 African Union member states in the Southern Africa region: Angola, Botswana, Kingdom of Eswatini, Lesotho, Malawi, Mozambique, Namibia, South Africa, Zambia and Zimbabwe.
For us, this gives us an opportunity, one, to anchor the regional body, to strengthen in-country coordination, collaboration, communication, and also to ensure that we up our game in terms of various assets which we have as a country. This opportunity also has placed Zambia at the epitome of response with respect to various outbreaks, pandemics, and in general the public health threats and emergencies which may besiege us. It does is that Zambia now will be a spotlight as we coordinate the other member states.
Since its inception, the RCC has facilitated an assessment of existing public health capacity in the African region, leading to the identification of key public health priorities and the development of a strategic plan to address the capacity gaps.
Our mandate is to support all those countries build resilient healthcare systems that can respond to emergency in the outbreaks, or is a man-made or is a national disaster.
As a regional centre, the RCC has played a pivotal role in bringing member states in the region together regularly to exchange information, knowledge and experience in the response to several public health emergencies.
We have been able